You push yourself out of a chair, rise in one quick motion, and suddenly your legs begin to shake. Your knees feel unreliable. The room may dim around the edges. For one strange second, it feels as if your body has forgotten how to stand. But your legs may not be the real problem. The moment you stand, gravity launches a silent attack on your circulation. Blood is pulled toward your legs and abdomen. Less blood returns to your heart. For a brief instant, less blood may reach your brain. Your body has only seconds to correct the imbalance. When that correction is delayed, your muscles can tense, your balance can wobble, and your legs may tremble as they fight to keep you upright. So why does standing up quickly make your legs shake? And when is it just a harmless head rush versus a sign that deserves medical attention? Stay with me, because the answer reveals that standing is not a simple movement. It is a high-speed rescue operation your body performs every day without asking permission. And if you enjoy discovering the hidden engineering inside ordinary moments, subscribe now, because the next few minutes will change the way you think about gravity. Most people blame weak legs. They imagine the muscles have become lazy after sitting. That explanation feels obvious because the shaking happens in the legs. But the location of a symptom is not always the location of its cause. Think about a building whose lights flicker when the power grid suddenly changes load. The flickering bulbs are visible, but the real problem may be far away, inside the system that supplies electricity. Your shaking legs can work the same way. They are the visible end of a rapid struggle involving your blood vessels, heart, brain, nerves, and muscles. When you are lying down, your blood is distributed relatively evenly because your body is horizontal. When you stand, gravity shifts a significant amount of blood toward the lower body. That shift reduces the amount returning to the heart. If the body does not compensate fast enough, blood pressure can fall and the brain may briefly receive less blood flow. Lightheadedness, blurred vision, weakness, confusion, or fainting can follow. Doctors call a sustained pressure drop after standing orthostatic hypotension, or postural hypotension. A common clinical definition is a fall of at least 20 millimeters of mercury in the top blood pressure number, or 10 in the bottom number, within 3 minutes of standing. Have you ever felt your vision dim after standing? Type yes or no in the comments. Now imagine the blood vessels in your legs as soft vertical tubes filled with liquid. When you stand, gravity tries to stretch that liquid downward. Your body responds with pressure sensors called baroreceptors. These sensors sit near major arteries in the neck and chest. They act like security cameras watching the pressure inside the system. The instant pressure falls, the baroreceptors send an alarm to the brain. The brain answers through the autonomic nervous system, the automatic control network that manages functions you do not consciously command. Your heart speeds up slightly. Blood vessels tighten. More blood is pushed back toward the heart and brain. In a healthy response, this happens so smoothly that you notice nothing. Your leg muscles also help. Each time the calves contract, they squeeze nearby veins and push blood upward. This is sometimes described as a muscle pump. Picture someone squeezing a flexible tube of toothpaste from the bottom. The squeeze forces the contents upward. In the same way, contracting leg muscles help move blood against gravity. But when you jump up suddenly, the system has less time to prepare. Your abdominal and leg vessels may not tighten quickly enough. Your heart may not increase its output fast enough. Your balance system detects instability, and your muscles begin making rapid corrections. Some people describe that as weakness. Others call it trembling, buckling, or jelly legs. Why do the legs show the struggle so dramatically? Because they are doing two jobs at once. They must support nearly the entire body while also helping return blood upward. The ankles, knees, and hips form a stack of moving joints. Your brain constantly estimates where your center of mass is and sends tiny corrections to the muscles around those joints. When vision dims or the inner balance system detects a sway, those corrections become larger and faster. Instead of a smooth contraction, opposing muscles may tighten in quick bursts. The result can feel like vibration, even when the main disturbance began in circulation rather than in the muscles themselves. There is also an especially rapid form of the pressure drop, sometimes called initial orthostatic hypotension. It can occur within the first several seconds after standing and may recover quickly. Because ordinary blood pressure cuffs measure too slowly to capture every instant, a person can experience a genuine head rush even when a later reading appears normal. That does not mean every brief sensation is a disease. It means timing matters when a clinician interprets the story. Your breathing can influence the moment too. Holding your breath while straining to stand changes pressure inside the chest and can briefly alter blood returning to the heart. People sometimes do this without noticing, especially when rising from a low seat or when their legs are tired. Exhaling normally, using the armrests when available, and avoiding an explosive upward movement can make the transition steadier. The goal is not to move like you are fragile. It is to give several automatic systems enough time to coordinate. And remember that shaking is a description, not a diagnosis. One person may mean visible trembling. Another may mean the knees feel hollow. Another may be describing a heartbeat pulsing through tense muscles. A useful medical history translates that single word into observable details. Did both legs move? Could someone else see it? Did walking help? Did sitting stop it? How many seconds did it last? Did consciousness change? Those answers help separate a balance correction from a circulation problem, a metabolic issue, or a movement disorder. The shaking itself does not prove that blood pressure has dropped. It may reflect several things happening at once: muscle bracing, momentary imbalance, fear after feeling dizzy, fatigue, or an actual tremor. That is why one symptom can have more than one explanation. A brief episode is more likely after dehydration. When your body has less fluid available, the circulation has less reserve to work with. Heat can make the problem worse because blood vessels near the skin widen to release warmth. Illness, vomiting, diarrhea, heavy sweating, or not drinking enough can also reduce circulating fluid. Some medicines can contribute by lowering blood pressure, changing heart rate, or affecting the nervous system. Medical conditions involving the heart, hormones, diabetes, or the autonomic nerves can interfere with the normal standing response. This is where the phrase "I just stood up too fast" can become misleading. Speed may be the trigger, but it is not always the underlying cause. Standing quickly is like flipping a switch that reveals how much reserve the system has. A well-hydrated, rested body may adapt instantly. A body under stress may hesitate. Low blood sugar can also produce shakiness, sweating, weakness, hunger, or confusion, although that is a different mechanism from orthostatic hypotension. Anxiety can create trembling through a surge of stress hormones. Lack of sleep, fever, pain, or intense exercise can make muscles less steady. And if the shaking appears only while standing still, continues instead of fading, and improves when sitting or walking, doctors may consider rarer movement disorders such as orthostatic tremor. That condition is different from a quick head rush and requires proper neurological evaluation. There is another condition that is often confused with orthostatic hypotension, postural orthostatic tachycardia syndrome, usually shortened to POTS. In POTS, standing causes an excessive rise in heart rate along with symptoms such as lightheadedness, fatigue, palpitations, or shortness of breath. It does not simply mean that anyone whose heart beats faster after standing has POTS. A clinician must look at the pattern, the size of the heart rate change, the duration of symptoms, and whether blood pressure drops. Which sensation happens first for you, shaking or dizziness? Type just one word, shaking or dizziness. Now we reach the most important part. What should you do in the moment? First, do not try to prove that you can push through it. If your legs shake and you feel faint, sit or lie down safely. The goal is to prevent a fall while blood flow recovers. Holding a stable surface may help, but do not rely on a light chair, moving door, or anything that can tip. If you are near stairs, traffic, water, machinery, or a high place, treat the warning seriously. For future transitions, rise in stages. Move from lying to sitting. Pause. Place both feet on the floor. Tighten and release the calf and thigh muscles a few times. Then stand while holding something stable. This gives the circulation extra seconds to adjust and activates the muscle pump before gravity takes full effect. Hydration may help when dehydration is contributing, but the correct amount depends on the person and any medical conditions they have. People with heart or kidney problems may have fluid restrictions. Increasing salt is not a universal solution and should not be done casually, especially when high blood pressure or other conditions are involved. Never stop a prescribed medicine because of a video. A clinician or pharmacist can review whether a medicine might be contributing and decide whether any change is appropriate. And this is exactly why you should subscribe before we move deeper. The most dangerous health myths are often built from advice that sounds simple, works for one person, and quietly harms another. Here, we separate the useful principle from the reckless shortcut. If episodes keep happening, write down what surrounds them. Note whether you had been lying, sitting, exercising, showering, or standing in heat. Record whether you felt dizzy, saw spots, noticed a racing heart, had chest discomfort, felt short of breath, or actually fainted. Also note recent illness, reduced eating or drinking, and any medication changes. A pattern is often more useful than a vague memory. A healthcare professional may compare blood pressure and pulse while you are lying down and again after you stand. One standard approach measures after several minutes lying down, then around 1 and 3 minutes after standing. Depending on the history, the evaluation may also include an examination, medication review, an electrocardiogram, or blood tests. The purpose is not merely to label the symptom. It is to discover whether the trigger is fluid loss, anemia, a heart rhythm issue, a medication effect, a hormone problem, autonomic dysfunction, or something else. Notice how different this is from guessing. The same feeling can come from different systems. A racing heart with stable pressure tells a different story from a large pressure drop. Shaking that lasts 2 seconds after jumping up is different from shaking that continues every time you stand still. Weakness on both sides is different from sudden weakness on one side. Details are not decoration. They're the map. Now imagine the automatic rescue system failing completely. You stand. Blood shifts downward. The vessels do not tighten enough. The heart cannot compensate. Blood flow to the brain falls. Your vision narrows. Sound becomes distant. Posture collapses. You faint. Fainting can be brief, but the fall can cause serious injury. The danger may come not only from the circulation problem, but from where it happens, on concrete, beside a road, in a shower, or near stairs. Frequent orthostatic symptoms are also important because persistent orthostatic hypotension can be linked with falls and may signal an underlying medical problem. Some warning signs should not be treated as a normal head rush. Seek urgent medical help when dizziness or shaking comes with chest pain, severe shortness of breath, an irregular heartbeat, fainting with loss of alertness, sudden trouble speaking, sudden vision change, or sudden weakness or numbness, especially on one side. Persistent confusion, a severe sudden headache, major bleeding, or an injury from a fall also needs urgent attention. Even without those emergency signs, arrange a medical check if the episodes are frequent, getting worse, lasting longer, causing falls, happening during exercise, or occurring with repeated palpitations. A single brief wobble after rising on a hot day may have a simple explanation. A repeating pattern is information your body keeps sending. Would you wait or get it checked? Type 1 for wait or 2 for check. Here is the deeper twist. Standing upright is one of the most unnatural things your circulation must do. Gravity does not care that your brain sits at the top of your body. It continuously pulls blood downward. Every second you remain upright, your nervous system, heart, blood vessels, breathing, balance organs, and muscles cooperate to keep oxygen reaching the brain. You experience the result as stillness, but underneath that stillness is nonstop correction. In engineering, a stable structure is not always one that never moves. Often, it is one that detects movement and corrects it before the movement becomes visible. Your body works the same way. Balance is not the absence of falling. It is thousands of tiny actions that prevent a fall from becoming real. That means the shaking in your legs may be a glimpse behind the curtain. For a moment, the corrections become visible. The hidden machinery announces itself. Your knees vibrate, your muscles brace, and your awareness narrows because a system normally operating in silence has been pushed close to its limit. But that glimpse should not be used to diagnose yourself. It should be used to ask better questions. Did it happen once or repeatedly? Was there dizziness? Did the heart race? Did you faint? Were you dehydrated, ill, overheated, or taking a new medicine? Did the shaking stop quickly or continue while standing? Those differences point toward different explanations. Your body is not betraying you when it sends a warning. It is reporting a problem in real time. So the next time you stand and your legs suddenly shake, do not dismiss it automatically, and do not panic automatically. Pause. Get safe. Notice the pattern. Rise more gradually. And if it keeps happening, bring the details to a healthcare professional. Subscribe, because the ordinary things your body does are often the most extraordinary machines you will ever study. Your next ordinary symptom may hide yet another extraordinary survival system. And now one final question. If gravity can disrupt your brain in seconds, what exactly happens inside your body when you faint? That is the mystery waiting in the next video.